Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is acute and chronic tonsillitis. We will cover this topic of acute and chronic tonsillitis in 5 sections. In the first section, we will talk about the blood supply, venous and lymphatic drainage, and also functions of the palatine tonsils. So, first section, we will cover mainly the palatine tonsils, what's the blood supply, venous and lymphatic drainage, and the functions of the tonsils. Then in the second section, we will discuss the acute tonsillitis, acute inflammation of the tonsils, how the patient with acute tonsillitis present, what are the signs and symptoms, how we can treat the acute tonsillitis, and besides this other type of condition known as the faucial diphtheria or the tonsil diphtheria. That will be also discussed in this section. Then in the third section, we will talk about some differential diagnosis of the tonsillitis and what are the conditions that can be mistaken or confused with acute tonsillitis. Conditions like agranulocytosis, leukemia, atrophic and traumatic ulcers of the tonsils, and also candidal infection of the tonsil. So all this differential diagnosis will be discussed in section 3. Then in the fourth section, we will move to chronic tonsillitis, and in that we will talk about the etiology, what are the causes of chronic tonsillitis, what are the different types of chronic tonsillitis, what are the clinical features, signs and symptoms, and also treatment of chronic tonsillitis. And very important in this section is also what are the complications of chronic tonsillitis. Then in the fifth and final section, we will talk about the lingual tonsil, and then what's the acute lingual tonsillitis, hypertrophy of lingual tonsils, and also the abscess of the lingual tonsil. So this lecture will cover all about the palatine tonsils and the lingual tonsils, some differential diagnosis that needs to be discussed, and how we can differentiate between different conditions that are similar to tonsillitis. So all this will be covered in today's topic. So keep watching sqadia.com.